Hello, welcome back to the podcast. Welcome back, wonderful technologists. So, recording this last episode before we go on this Thanksgiving break. Man, can you just believe it? Like, Thanksgiving is here, and you blink. I mean, it was just summer not too long ago. I mean, I know summer has come and gone, and Halloween and all that stuff, but yeah. And before you know it, Christmas and then a new year. Very, very, very exciting stuff. So hopefully you guys got some goals and some things that you want to accomplish for 2024. I know I do. So I got some good things in the works, especially for the CT educator, the podcast, courses, collaborations, some good stuff in the works. So got to stay tuned for that. So make sure you follow on Instagram so you can check in on those updates and, subscribe to the podcast. You know, and leave some good feedback and let me know what you think. So always encouraging feedback or send me an email. So I figure in this week's episode, we talk about one of the other series I've created, because in the last episode, we were talking about CT trauma stories. So this is CT scan stories. So these are just some regular stories on some cases that I've done over the years that have either made me raise my eyebrows or kind of shocked me, or just really, it's just like, oh my goodness. So today's episode, we're going to talk about contrast media near miss. So this is a case that I had recently, very recent, as I was working my 12-hour shift. It's one of those cases that I tend to remember because it's very rare that I get very upset over a case or get upset over a patient or anything like that. So it's not what you think. So I'm going to kind of take you through this story in this episode. So like I said, this case happened recently. It was a CTPE that I was doing. And the patient happened to be a bariatric, very large patient. And they were highly concerned because she did have a history of it and had a history of DVTs, had a history of PE. And they were highly concerned because the last time she was hospitalized, she actually did have a PE. So made it legit. Not one of these, oh my gosh, this is bullshit kind of case that we as technologists encounter all the time. No, this was actually legit as far as ruling out what we needed to. So usually we ask that the patients, especially when they're over 250 pounds and they are not mobile, we have safety protocols in our trauma hospital that the patients have to come on a slider, blow up mattress that we blow up so we can move them. Now, it's very essential for this lady. So we specifically called the floor, said she needs to be on an air mattress so that we can move her safely onto the CT table. Now, our 256 can take up patients, over 600 pounds because that opening is a little bit wider. It's probably about 10 cms wider than your normal gantry opening. So usually if we have a bigger patient, we tend to use that room, the 256, so we can accomplish an optimal exam. So the patient comes down. We had reviewed the patient's chart beforehand, made sure that all the orders were correct, make sure that the patient had the correct IV. She had a power pick line, which is great. Especially with patients who are larger, we need good IV access so we can accomplish what we need to, right? Made sure allergies were legit, labs, the whole 9 yards. So everything was tip top. Patient comes down. We had to call X-ray because we needed like 3 additional people from X-ray to help us, while we blow up the mattress, move the patient. So I went ahead and I explained to the patient, we flushed her power pick line before we even moved her. Like we got everything out of the way. Went ahead and blew up the mattress, moved the patient, got her centered properly. I told her, I apologize. I know you're going to be uncomfortable. Made sure those safety straps were in there so she would fit in the machine with no problems. And I specifically asked the patient, I said, ma'am, you're going to have to put your arms above your head. Now, when you have a patient that size, So we're talking, she was, 480 pounds. And, she was short like me. I'm 5'4". The patient was 5'2". So we specifically stress that the patient has to put their arms above their head. You cannot scan a patient with their arms down. They have to put their arms above their head. So she was able to do that. So then I started explaining as far as what's going to happen from the beginning to the end of the test. She said she had a CT scan before. She's had several of them. And then I started to explain contrast, what she was going to feel, what was going to happen. And as I'm about to position her, and I ask her if she has any questions, oh, I'm allergic to contrast. Naturally, my face was like, what? I'm allergic to contrast. I can't do this exam. So then I said, okay, what happened when you got injected with contrast last time? She goes, well, I got very hot. Okay. Anything else? Well, I started to get chest pain and I started to break out in hives. So at that very moment, I am going to say this. We as technologists are very professional. We as technologists execute the best patient care, the utmost respect for our patients, the just kind compassion that we show towards our patients. I have to say, I got very upset at the patient. And I'm going to tell you why. And some of you may agree, some of you may disagree, and that's totally fine. Where I got upset with the patient and I kind of lost my shit on the patient. Yes, I will say that because I am unapologetic. But I will tell you what the patient did at the end where, she was very appreciative of me making sure that I did my job correctly. So I will explain what happened afterwards after I'm done telling this part of the story. So I stopped and I said, okay, so those are all the symptoms. I said, how long ago did you have that reaction? Well, it was fairly recently, like a couple years ago. Okay. My next question is, did you inform the nurses and the doctors that come in and speak to you and tell you that they were going to order this test that you were allergic to contrast media? The patient tells me, well, no, there's a lot of things I didn't tell them. That's where I kind of snap. And I know as technologists, we're supposed to be professional and we're not supposed to go this route. However, for me, it was a fine line where I'm trying to save your life because you could have a life-threatening illness and you're gatekeeping information that could possibly end your life. And that's kind of where I went. So I specifically informed her, I said, ma'am, you cannot gatekeep information and withhold information for us. When you come into the hospital, you need to explain all your allergies, everything, all the medications you take. If you can remember every test that you had done or something similar, it's okay if you don't remember every single test. However, when it comes to allergies, that is something that you should be able to let us know and not withhold that information. I said, you are alert, you're oriented, and you know exactly what's going on here. And I said, you could have potentially ended your life if you did not tell me that you were allergic to contrast media. And she looked at me just horrified and immediately started apologizing and said, I am so sorry. I said, ma'am, it's okay. And I said, however, this could be a life and death situation where you could put me in and yourself. So please do not withhold information. When doctors ask you what you're allergic to, you need to explain all your allergies. And I said, so you didn't tell anybody. They didn't document this in your chart because it's not there. And I said, did you let the nurses know? Well, no, I didn't really tell them a whole lot because I felt that I didn't need to. Yes, you do. Yes, you do. And she could tell by my tone that I was very, very upset. And I had to step back and explain to her, this is why you don't gatekeep information. You cannot lie to us and you cannot withhold information because you could potentially die if you do. And then you can't say, oh, well, I didn't think that that was important. Ma'am, that's very important. Okay. Because this is a medication that I am administering under my licensure that I could lose if you die. Okay. So I had to go back, speak to the patient's nurse, inform her of what happened. Even her nurse was upset that she did not inform us about all of the allergies because she actually had more allergies than she did not tell them. Now, I can understand if patients are afraid to communicate with us as healthcare providers and healthcare workers. I totally understand that because when going into a hospital, it's a very scary thing. And it is our job as professionals to make sure that we make them feel safe, we make them feel comfortable, and talk to them like they're our best friend or like they're our brother, our sister, or even your mother. That is what we're supposed to do. And I could tell you once I let her know, I said, ma'am, they're going to pre-medicate you for this test. So you will come back tomorrow and get this exam done. It has been noted in your chart that you're allergic to contrast media. If you happen to go to another hospital, please inform them of all your allergies so they are aware and they don't put you through something unnecessary like this. The patient looks at me. She says, I really appreciate you advocating for me and making sure that you didn't put me through something harmful. She goes, I appreciate you so much. Thank you. She said, she just kept thanking me because I saved her life. And she says, never again am I ever going to not tell anybody. She goes, I so apologize. I said, listen, it is perfectly okay. There's no apology needed. And I said, but it is my job to inform you of everything we're going to do, what we're going to put you through, and make sure that you have the safest test possible, the optimal test as possible, and make sure you get your diagnosis so you can feel better and go home. That's the goal, right? So she just thanked me for saving her life. You know, she says, I am so sorry. The next day, she got pre-medicated properly. The next day, she had her test. And luckily for this patient, everything came out okay. And I think it was a couple of days later, she was able to get discharged and leave the hospital. So I know that some of you may have opposing views on how I went about the situation. As a technologist, I stand firm that it is my job and my duty to make sure that I explain to the patients exactly what is going on and make sure I execute safety, within all measures, because that is the goal. Okay. And a lot of times patients hide things because they're scared, they're terrified, they've had bad experiences. And it's up to us to make sure that we provide that positive, comfortable, safe experience. And that's why she was able to share with me, oh, well, I'm allergic to contrast, even though I was getting ready to start the exam, which can piss off any technologist if we're really going to be 100% honest, right? But I was firm and I let her know, you need to tell people because it can mean your life. And sometimes when you say it to patients like that, I'm telling you, they're not going to gatekeep stuff. As long as they're alert and oriented, they're not going to gatekeep anything. Okay. And that was the point that I was trying to make. So that is one of my CT scan stories for the week, right before Thanksgiving. And it's a case that happened recently. And those cases usually stick with me, for a good while. So usually that's my Pandora's box of cases that I've done over the 22 years that I've been a technologist. So I hope you guys enjoyed this CT scan story for this month. So I'm going to wrap this up with, if you have any interesting stories, please send me a DM on Instagram, send me an email. They're always open. I'm always up to listening and learning about you as a technologist and hearing your stories, because I love stories, because you could tell I love storytelling. That's why I have a podcast. So If you need some resources, CT courses, if you're new, a beginner, just starting out CT, I have some excellent resources and some courses that you can take. I'll leave all the links and all the courses listed in the show notes. So you can come, get your learn on, get some CEs while you're at it, because I am developing new courses for 2024. So, because we're going to kind of wrap up the year and take a little break from doing courses and recording for the holidays. So, need CT courses? Make sure you check out the links on the show notes. And if you haven't, make sure you check out other great radiology podcasts because there are a lot of great ones, especially Collaboration RA, the Catheter Jockeys. They're my good friends. Love those guys. Love Collaboration RA. Marceline and Reese are awesome. A couple of rad techs, your X-ray tech. There's a lot of great radiology podcasts out there. So make sure you also check those out. Okay. So thanks for joining me on CT Scan Stories for this episode for this week. Hope you guys have a wonderful, safe Thanksgiving, and I will see you right after the holiday.